Hello everyone. So in order to wrap up the Nurses Week for the year 2025, I decided to come up with this video on HIV and AIDS. My name is Nancy Ozon. So let's get straight to business. HIV is a human immunodeficiency virus. It is a virus that affects or that attacks the cells that helps the body to fight infection, thereby making one more vulnerable to other infections and diseases. What are the modes of transmission? HIV can be transmitted through unprotected sexual intercourse with a HIV-positive person. It can be transmitted through sharing of sharp objects used by a HIV-positive person. This virus can also be transmitted from a pregnant mother, to her child. It can also be transmitted through blood transfusion. That is transfusing a positive blood, not a negative blood. And from mother to child transmission, a positive mother, not a negative mother. So this virus, what are its signs and symptoms? HIV signs and symptoms differs depending on the stage, because it has 3 stages. We have the acute stage, we have the chronic stage, and we have the AIDS stage, or should I say the progressing to AIDS, that's the 3rd stage. So the first stage, which is the acute stage, this stage, within 2 to 4 weeks of being infected with this virus, one can present with flu-like symptoms like headache, fever, muscle pain, etc., etc., etc. And in this stage, it's not, there are some people that might not come up with any signs and symptoms. Not everybody presents with these signs and symptoms. Then the next stage is the chronic stage, that's the stage 2. In this stage, the viral load is high. The viral load is very high in this stage. I forgot to mention that in the first stage, one can transmit this virus easily, more than in the chronic stage. Yes, so in this chronic stage, it can take up to 5 to 8 years before someone in this chronic stage can progress to the 3rd stage, which is the AIDS stage, if not on treatment though. But if on treatment, one cannot progress to the 3rd stage, which is the AIDS. And in this 2nd stage, the chronic HIV stage, once the person is on medication and the viral load is undetectable, there is no means of transmission. But with a detectable viral load, one can transmit the virus to his or her negative partner. Then in the 3rd stage, which is the near grave stage, that's what I usually call it, that's the AIDS stage. This stage has no cure. The AIDS stage has no cure. So in order not to progress to this stage, I advise that you start your medication on time, as early as possible. Signs and symptoms of this AIDS defining stage includes chronic diarrhea, enlarged lymph nodes, weight loss. Even there are opportunistic infections. So, like I said, in order not to progress to the AIDS stage, one has to start medication on time. Yes, HIV has no cure, but it can be managed. That is one thing with the virus. It has no cure. Before they will tell you that there is a cure for HIV, there is a herbal medicine that cures HIV. Now lie. It is not yet scientifically proven that HIV has a cure. But there is a medication to manage it known as antiretroviral virus. Before we dive into that, how can I know that I have HIV? HIV, they show for face, so they show for face. You can only know that you're HIV positive when you get tested. So what am I trying to say? After watching this video, rush now and go and get yourself tested. The earlier the better. Once you get tested and it turns out that you are HIV positive, the best thing one can do is to go and start treatment. Once you're on your ARVs, antiretroviral therapies, you will not progress to the chronic stage, not to talk of the AIDS defining stage. And also there are preventive measures to take in order not to be infected with HIV. The first one is use condom. Oh, I always say it. I always talk about it. If you hear me advocating for condom, it seems as if my father is the owner of this company that produces these condoms. No. Have protected sexual intercourse, number one. Number two, there are drugs. Yes, there are drugs that can help one, that can prevent one from getting this virus. It's called the pre-exposure prophylaxis, PrEP, and the post-exposure prophylaxis, PEP. These two drugs are different drugs. One is being taken before exposure, that is the PrEP, while the next is taken after being exposed to the virus, that is the PEP. We will talk about PrEP and PEP in another video. But in this video, I just want to tell us about this virus, that HIV no dey show for face. You can only know that you're positive if you get tested, and that HIV is not a death sentence. Once positive, you start your drugs. Once you're taking your drugs and you have you have an undetectable viral load, you won't transmit this virus to your partner, and you will also live long. You will not progress to the third stage of HIV. So I think I have to stop here. I don't want this video to be lengthy. Maybe in my next video, we'll talk about other things like the PrEP and the PEP. Like I said, avoid unprotected sexual intercourse, especially with someone you don't know his or her HIV status. Thanks for watching. Bye.